Okay, so I am going to, I think everybody's in. I'm probably going to have members of the department introduce themselves. I want to thank Ellen Killer-Carlson for helping me and the rest of the crew helping me organize this. We did this workshop live and actually in person in Lexington. We got a special grant and it was very well received. And we thought we would be able to offer this on a webinar. And what we requested was that we have more of a statewide view. So the one we did in Lexington, we had just, you know, personnel from that.
If this bothers anybody, let me know and I'll go to the other room.
So, but today we have representation from the state. So that's pretty awesome. So I am going to let Liz share her screen. And I thought maybe we could, Liz, if you wouldn't mind introducing yourself, then maybe Ellen, Ingrid, Colleen, Lindley, and I believe Colleen just came in. Or not Colleen, somebody, the other one.
So,
yeah,
Carrie, can I just ask the people?
Yeah, please mute yourselves. Because it's being recorded.
Probably did create
Carrie, do you have a way to mute, do you think?
I'm doing that right now.
Okay.
So it's helpful if you help me mute because it takes a while. Whoops, I just muted you, Liz. I'm sorry. You're gonna have to unmute yourself.
That's okay. I'm going to go ahead and get started and share my screen in just a minute. I just wanted to say thank you everyone for having us here today. We have a wonderful group. I have a wonderful group of colleagues with me today that I'm looking forward to introducing, and we're looking forward to having some great discussions. There's going to be time for questions and answers. Questions at the end of the session is my understanding. If we don't get to everyone, feel free to use the chat to ask some questions as well as we're going through the presentation. So I'm Liz Sandblom. I'm the Deputy Assistant Commissioner of Field Operations. And here with me is Lainey Bruner-Canute. She's the Assistant Commissioner of Quality Management at DDS. We have Ellen Kelly-Carlson, who's Central Office Director of Family Support. So she sort of oversees the family support for the whole state. Ingrid Flory, we should be waving actually when we introduce ourselves, but you'll see them all today, is the Family Support Director in Central West. Colleen Mulligan is the Southeast Community Systems Director. And Lindley Jordan is the Area Director for Middlesex West. Did I get it right? No, I didn't. I'm so sorry, Lindley.
It's okay. Central Middlesex.
Central Middlesex. I do that all the time. So I'm going to share my screen now with you all. We have a presentation prepared. So can people see my slideshow?
Yes, but you need to put it on slideshow.
Yeah, I was just going to start that now. So
awesome. You're good.
Okay.
Oh, this is from DDS. Forget it. I can do this some other time. Yeah.
So as we go through our agenda today, you're going to be hearing, as I said, from different folks throughout DDS, and we'll reintroduce ourselves when we start speaking again. So I'm just going to do a quick snapshot of DDS for everyone. The mission of DDS is, really we are dedicated to creating, in partnership with others, innovative and genuine opportunities for individuals with intellectual disabilities to participate fully and meaningfully in and contribute to their communities as valued members. We also now support people that don't have an intellectual disability, that are on the autism spectrum. And of course, they're part of our mission as well. This is just some data that I wanted to share with you by region. So we support, or we have about a little bit over 45,000 individuals that are eligible for services, with DDS. And you can see this is by region. Central West is, used to be 2 regions and is now 1. So you can see they're blue. They're a little bit larger than the rest. And then adults by residential site, and that's just a little bit of a misnomer. This is just where do people live. So you'll see the purple slice here. These are people that are living with families and that have, family members who are caregivers. And they're living at home with family members. So really, this is the group of people that we're talking about today and how DDS supports families. Enrollment by service type is interesting. Supports is the largest group of enrollments, and that includes our family support, our array of family support services that you're going to be hearing about today. And then just briefly, the operations unit is a unit of folks that have different expertises in residential, day and employment, supportive technology, family support, and self-direction. And really what we do in the operations unit as central office is we really strive to support the field. And in turn, the field is working with you all as individuals and family members and caregivers to, help address, what is your vision? What are your goals? What are you trying to work on? And what supports may work to help you meet those goals. Finally, I just wanted to sort of talk briefly about the operation unit's vision theme. So as a group, we've worked throughout the last year or so on really formalizing kind of what are our vision, what do we do? And these are all things that are really important to us and to the field. We are focusing on person-centered and family-oriented practices. We want to make sure that services and resources are flexible, cost-effective, allocated according to a standard of fairness, equity, and provided in the most culturally competent way. We want to make sure that our services are available and they're clear and concise information is going out in all different formats, that it's accessible, that we provide information in different languages, and that information about our services is user-friendly in plain language. For those of you connected to DDS for a long time, you know that we love acronyms and shortening names of things, and that gets really confusing to everyone. So we're working hard to make sure that we're using plain user-friendly language when we provide information. Again, same with, person-centered, family-oriented. We want to provide flexible supports that are built around people's dreams, aspirations, and the potential for reciprocal relationships. We want to collaborate with internal and external stakeholders, individuals, families, and provider agencies. We, as an operations unit, want to serve as a strategic resource to our partners, to our field, our area and regional offices, external stakeholders, et cetera. Innovation has been a really exciting piece of the work that I've been doing in the last few years with our team, or that we've been doing with our team, really bolstered by, unfortunately, the pandemic, but it's given us the opportunity to use innovation to develop person-centric policy and language in new services as well. And then use both process and outcome level data to influence our policy decisions. So we're working hard as a department to really gather really important outcome data and information, and turning to that and using that as we look at what our policies and different decisions that we make. And again, I just want to emphasize that we truly believe that all people have the right to live, love, work, play, and pursue their own life aspirations in their community. So that said, next up, I'm going to introduce Lainey Bruner. Knut, who is the Assistant Commissioner of Quality Management, and she's going to talk about the needs assessment summary.
Great.
Thank you, Lainey.
Thank you. Thank you, Liz. You can go to the next slide. As Liz says, we're trying, DDS is really dedicated to using data to help us to drive our policies and our services. And so I'm going to talk about data today. Some background first to lead us into the needs assessment. DDS has received funding from the Massachusetts State Legislature for the past few years to address the needs of older adults with intellectual and developmental disabilities. In the past, we've looked at focus areas such as healthy aging and clinical resources, end of life and future planning, and community integration and retirement activities. One of our recent goals has been to learn more about the needs and concerns of older and aging parents, siblings, and caregivers as it relates to older adults with IDD. And so we're most interested in learning how these folks were connected or not connected with services, how they navigate services, the value they place on person-centered supports and future planning, their views on interagency and provider collaboration, and how they view DDS as engaging meaningfully and culturally appropriately through that lens. So we asked the Center for Developmental Disabilities Evaluation and Research, or CDER, we do like our acronyms, to conduct the needs assessment. This needs assessment was conducted during the spring and summer of 2022. Next slide, please. I want to just talk a little bit about the methods. So CDER conducted individual and small group key informant interviews, as well as focus groups. Participants in these interviews and focus groups included family caregivers, family support center staff, DDS and other government agency staff, provider staff, and community organizations. In all total, they completed 23 individual and small group interviews and 16 focus group interviews for a total of 122 participants. Most of these groups were held over Zoom, with one held in person and one held in a hybrid method. Next slide, please. I'm going to talk about the general themes that came out of the needs assessment, and there were 5 major ones that CDER recognized. Older family caregivers and families are often not engaged with DDS. They may be eligible for services. The individual they care for may be eligible for services, but they may not be prioritized for services. So they may not have a service coordinator. There may not be an ISP. And so they're not as connected to DDS. Also, they may not, oftentimes there was a lack of understanding of the system. There were some fears involved with this, fears and mistrust, fears of losing control, mistrust based on previous experience and anecdotes related to DDS. Some caregivers thought that DDS services mean institutionalization. There was also some concerns about abuse that might be happening. This leads directly into the next major theme, which is engagement and navigation supports. By and large, folks really thought DDS services were difficult to navigate and that there were varying levels of support provided. The application process is often seen as time-consuming and daunting and difficult to even access and understand, especially considering that often older caregivers may be trying to interact with the system in a time of crisis or in a time of stress. All of that led to it not being very supportive, it not being very easy to navigate. Folks also talked about how there didn't seem to be much transparency in terms of service prioritization and in matching services. Cultural and linguistic competency varied by location, by area, by region, by family support center. And from the interviewees' point of view, there seems to be limited translated materials and interpreters available. And so I think this is really a key point that we need to be looking at. Next slide, please. Planning for the future and person-centered support. There were a number of things under this theme. There were families who were reluctant to plan for the future, where there was either denial or something else going on there. There was also, it was unclear to folks who were interviewed who, where, when future planning takes place. And we also, CEDAR also heard that when plans were created, oftentimes they weren't used, they weren't, I'll call it accepted, because at that point, they were not needed. And so trying to figure out how best to use any future plans with DDS services and service coordinators and the ISP process, that was a theme that came out. Finally, we asked questions about interagency and public-private partnerships and relationships. And by and large, collaboration between state agencies was seen as very limited. There were restrictions on sharing data, even between state agencies. So just because DDS, DMH, Mass Health are all under the Executive Office of Health and Human Services doesn't mean that we can easily share data at this point, and that was noted. Next, and so those were the major themes that were noted. And now we're beginning to work to figure out the next steps. And so one of the major things that came out in the interviews, but also that we recognized, was we need to figure out exactly how to identify older caregivers. And I know you're going to hear from DDS colleagues about how they've been working with that. Cultural and linguistic competency, as I noted, that certainly came out as something that we need to continue to build and improve. Looking at best practices to engage and guide older caregivers in planning processes, really trying to think through how best to do that. And also finally to exploring and improving our working relationships with other state agencies. So that in a nutshell was some of the data that we're using now to help drive decisions, drive processes forward. And I will turn it over to Ellen to talk a little bit more from the family support perspective.
Take myself off mute. Hi, everybody. Thanks for having us today. So to do this work, it's going to fall under the family support umbrella. So I am going to talk a little bit about family support services in a very broad way. So the goal really for our services for family support is to support families who have children and adult children with intellectual and developmental disabilities living at home with their families. And the family can be parents, could be living with siblings, it could be living with grandparents, it could be living with a very long time caregiver, individual served kind of situation. We want to engage families through, we have a variety of options, and hopefully that enables families to stay together and be welcomed and participate, contributing members of their communities. And then it is designed, family support is designed to be responsive, dynamic, and flexible because and flexible to the changing needs of individuals and the families, because we are supporting families or individuals throughout their lifespan. So most people that become eligible are going to stay with us till the end of their lives. So it's really the whole lifespan. Our DDS receives designated funds for family support services through the respite and family support account in the state budget. In our current fiscal year, our budget is a little over 90 million, and it's looking a little promising for FY24. We have, of the eligible population, there's a little over 9,000 kids that are under the age of 18. And then there's approximately another 13,000 adults living with their families. And the number that you saw earlier was people over 22. So if you add in the 18 to 22-year-olds and the children, we're supporting about 22,000 families that have their family member at home with them. And this includes the ASD without intellectual disabilities population. So in general, our family support is provided through a network of family support centers and programs throughout the state. So we have 52 centers across the state, and we cover every city and town. And every center works specifically with an area office. And this includes our 9 autism support centers, which support those adults with ASD without ID. Those centers also focus on supports for children and their families with ASD, and it also is where our autism waiver program is administered. And there's seven of those centers that administer that program. We have 10 cultural linguistic family support centers that are working in specific communities. That probably doesn't sound like enough. So in addition to those 10 specific cultural linguistic family support centers, there's 11 centers who have dedicated bilingual and bicultural staff to meet the needs of the communities that those centers are in. We also have a leadership program. There's 5 of those across the state, and that focuses on developing leadership skills and advocacy skills of the caregivers, parents. We have 23 intensive, flexible family support programs, and that's a more intensive support. And we also refer to that as IFS, another acronym. And then we have our medically complex program. And again, there's 5 of those in the state, and those are wraparound services for medically complex persons who most of those people are requiring nursing care as part of their plan. And then individuals and their families can also be supported through respite, peer supports, adult companion supports, individualized home supports, family navigation. Those services require a referral from the service coordinator. So in family support, the last couple of years, we've really been focusing on these priorities, rebuilding back our respite supports so that they can be planned, accessible, and predictable for families. And we've made some strides there. We are starting to have a little more availability of out-of-home overnight respite. We've created some weekend respite opportunities for families. So we're going to continue. That is a priority of ours. We also prioritize increasing flexible funds for more families, and I think we're, again, moving in that right direction. We need to improve our cultural competence around supporting families. And then mostly related to today, we are being more purposeful and intentional in our efforts to address the needs of older caregivers who have family members living at home with them. So you'll hear more specifically next steps later in the presentation. So I just noted, I didn't have slides. I just noted somebody put something in the chat. I didn't have slides for my presentation. So I'm going to pass this along to Ingrid Flory, who's going to talk about more details around what the centers offer. And so, thank you.
All right, thank you, Ellen. As you can notice, we're kind of working our way down to the more local level as we go through this presentation. So that was kind of a statewide snapshot of our family support system overall. Liz, you can go to the next slide. So I'm going to talk specifically about our family support centers, which are really a hub for a lot of the family support programs that we have. So, and I'm starting with this is that because research and experience has shown us that for family caregivers, there's really kind of 3 buckets of support that they need. You know, we need to know, we need assistance in finding out what's out there, discovering resources, and navigating all the different systems that we have to navigate, whether that's health insurance or or special education or DDS. We also, families need to connect with one another, because sometimes talking with peers who have similar lived experience is simply equally, or if not more valuable than talking to the best intentioned professional. And last, providing those goods and services that people need for day-to-day living. So all of our family support programs aim to address these 3 fundamental needs of families. Liz, you can go on to the next slide. So specifically, as Ellen mentioned, we have family and autism support centers sprinkled throughout the state. We also have cultural linguistic family support centers that specialize in providing support to different cultures. All of these centers help to inform, connect, and support families with the goods and services that they need, as long as they have someone living with them with an intellectual or developmental disability. So, and I always want to emphasize that families can access both their family support center and their autism support center. They really are meant to complement each other. Obviously, the autism support center is more autism specific, but the family support center, we really, we want all families who are eligible for family support to be connected to their local family support center, so that you're connected when you need them. So some of the services are available to anyone. So even if you are not yet DDS eligible, or if your family member is not DDS eligible, or if you're a supporting professional, you can call your family support center to get information, and they can help refer you to lots of different resources. This can be particularly valuable for some of our older caregivers who might not be as tech savvy and might prefer to talk to a real person on the phone, as opposed to doing an internet search. So our family support center staff are really knowledgeable and helpful. They also offer family trainings on lots of different topics that are all open to the public and all free. So our family support centers regularly offer trainings on planning for 2 generations, or on guardianship and other decision-making alternatives, on estate planning. There's lots of trainings that they offer that are relevant to caregivers as we age. We also, our centers offer lots of opportunities for people to network with each other. And that's for all family members. So whether that's parents, grandparents raising their grandchildren, siblings, the person with a disability themselves. And a lot of the time in thinking about older caregivers, that might look like a lot of our centers have grandparents groups or caregiver luncheons, panel presentations that feature family voices, and so people are sharing about their experiences. And then our centers are experts at that DDS application. So for anyone who wants some support around completing that, you can call your family support center. So if your family member is DDS eligible, there's a broader range of supports available. One of the most important things is service navigation. There's so many different systems that family members have to navigate. So that could be health insurance, could be special education. Some of our family support centers will reach out to their local elder services and have them come in and kind of offer clinics for families, so that they can see, okay, what caregiver supports might be available through elder services that would complement what's available through DDS family support services. So, and helping people navigate, SSI and other public benefits. They offer a lot of social and recreational opportunities, and they provide some respite for caregivers, and provide skill building and fun activities for the DDS eligible person. And then connecting people to the community is really valuable, just to help people know what's out there beyond what DDS provides. So that helps to expand people's circle of support and helps them to build a good life. And the last area that service that we provide through our family support centers is flexible funding. This is where a family will get an allocation and that they can use to purchase the goods and services that they need. So this can be particularly valuable if a family's on a fixed income. And so it expands upon those resources so that they can be meeting those disability related needs, financial needs for their loved one. So that might be to purchase adaptive equipment. It might be to hire caregiving so that, you know, parents can get out of the house for a little while. There's a wide range of things that that flexible funding can be used for based on what the family prioritizes. So that's a little overview of our family support centers services. And I'm gonna pass the mic to Colleen, who's gonna talk specifically about her region in Southeast and give some more specific examples than I have given of ways that these services are used for older caregivers.
Ingrid, good morning. I just wanted to sort of expand a little bit on what Ingrid has been talking about and what Ellen has spoken about and what we're doing down in the Southeast. And I have 3 examples. 2 are ones that are open to all adult DDS eligible individuals who might be appropriate for the service. The last example is much more specific to the reason why we're here today, for older eligible adults as well as and their aging caregivers. These are not unique to the Southeast, but they are an example of sort of where we as a department are trying to grow and trying to expand. They are pretty the 3 I'm going to talk about today are pretty staff intensive. So the development has been challenging with the current staffing crisis, but we're really working hard to try to get these resources that will hopefully be very helpful. So the first example I wanted to do does segue from Ingrid's discussion of the Family Support Center. One of our family support centers, and actually a number of family support centers statewide, provide weekend respite, overnight respite. And this weekend overnight respite is provided on a 1-to-1 basis. So it's usually 2 to 4 individuals with 2 to 4 staff. And they go to a hotel or some type of place that you or I would vacation and spend the weekend doing some fun things that the individuals enjoy. I wanted to give you an example of the Arc of Bristol County traveled with 4 ladies in December down to they call it an auto camp. I don't really quite understand what that is, but each woman had their own room and they had a little welcome basket when they got there of all sorts of cool things that they liked. They ate out, they traveled to Hyannis and saw the Polar Express movie or a rendition of that, played video games. They stayed up late Saturday night chatting and gossiping like girls do. So I had a wonderful time. One woman had not been away from her family in 40 years. And 2 of the families commented that they were able to spend time together while their daughters were making new friends and having fun. So these have been very successful. And again, they're a little they're staff intensive. So they have been a little challenging to have it done regularly, but we are finding that this has been really helpful for our adult eligible individuals and their families, even more so for folks who have caregivers who've been unable to get away for years, and they are always there 24/7. The second example I had is the Southeast last year entered into discussions with 2 agencies to develop a regionally planned respite programs. One of these already was a respite program, but did not have we were not able to fund it at where we needed to do in order to open it for 5 individuals, 7 days a week. So that has started in full force on July 1 and provides both overnight as well as day support. The other provides opportunities for overnight respite for 4 individuals, Sunday through Friday. They have historically done a children's program on the weekends, and so we were unable to purchase any time for the weekends. But this, like the previous example, was something we've gotten a lot of positive feedback from families who have not been able to go on vacation or who have not been able to take in a family wedding, as well as for people who have planned surgery or have illness and need some recovery time. So we've really found that these have been helpful, and we hope to develop more. And I know the rest of statewide people are working on these opportunities also. One mother had sent an email to our area office, and they forwarded it to Rick and I, that had said that her son was so disappointed when his respite stay ended and he couldn't wait to return. So those are really nice feedbacks that we had. The growth that we need to do in some of these respite programs are for families who have more medically complex children or behaviorally challenged children. That those we have not quite gotten to be able to provide that yet, but that's certainly on something that we are looking to expand on. My last example is very impactful, but it's a very small program, and I guess that's maybe is what makes it so impactful as it is. It's an intensive family support pilot that was started out of central office, and each region chose how they were going to implement that. And for the Southeast, we chose to do it with older individuals with aging caregivers who've lived at home with mom and dad, or mom or dad, for many, many years, and have not engaged really in DDS services for a number of reasons. And the couple of folks that this program has worked with spoke about the fact that they just they felt that they could do it and they didn't really need to, and that was just something that they wanted to do. And another family had some difficult experiences 20, 30 years ago, and just felt like they were going to provide those supports at home for their child. The program capacity, as I mentioned, is very small. It's only 2 to 4 families at a time. It's a 20-hour position, so the case manager goes in and really starts to establish that relationship with the family and then develop an individualized plan for their son or daughter. I could, if I have a little time, maybe I could talk about a couple of little examples. I'm not sure what we're running on time because I know Lindley still has her piece, but I wanted to talk just a little bit really quickly about one particular family. So Amy was in her 50s and her parents were in the early 80s. They did have a difficult time when she was in a day program and had in-home staff. The staff didn't show up on time and they weren't really happy with the day program. And so they had kept her home for 30 years. And the family was referred to this program that Better Community Living actually runs. And they did, the program director was telling me she spent a lot of time just having coffee with them and talking with them about, their past experiences, what kinds of things they do with Amy, what does Amy really like. Amy was medically fragile, had a lot of physical disabilities. And so they talked a little bit about some of the supports that they need, medical equipment and those kinds of things. Eventually, the program director was able to match a staff who had the same priorities as the family. They were very, very prompt whenever they came to work. And that was very important for the family, as well as a lot of other kinds of likes that Amy did also. So eventually, unfortunately, within a short few months after this program ended, mom was unfortunately diagnosed with Alzheimer's, got very, very sick, and unfortunately passed away. So dad was there by himself working on it. And this particular support staff that was there came in regularly. They hooked up PCAs who also had very similar values and were able to work with the family. And eventually, with some additional support, they really worked to get Amy prioritized for a residential program. And at this point, the staff still keep in contact with dad. It's just like one of those kinds of relationships that you develop with people, that you still maintain that as, you know, as you move to different parts of the life. So I just wanted to share those with you, and would like to pass it along to Lindley, who has more of an area-based perspective.
Good morning, everyone. So there are a lot of commonalities, and maybe Liz, could you just go to the next slide for me? I'm just going to give you a little bit of a snapshot of the individuals that are supported out of the Central Middlesex area office. So we were trying to determine how many of our individuals fell into various age groups. And you can see on the pie chart that there were a number of different pockets. So 18 to 21, 22 to 29. And what we're seriously, today focusing on is the 40 years and older group from our perspective, because we were trying to determine how many people that we have, that we believe that we know are living at home and believe are being supported by an older caregiver. And as you heard earlier, the older caregiver definition is really anyone in the family or brought into the family to support the individuals that we have that are 40 and older, and that we felt would have been older than the individual that we're supporting. Liz, can you switch over to the next slide, please? And so when we did the numbers, we determined that there were 104 people. Now, the stats are a little bit old, but they're old as as the days go by. So of the 104 people that we felt were in that category of having an elder caregiver, we decided, based on conversation with service coordinators and our knowledge of the families, that there were 21 individuals who were out with their families and not connected to the area office. And so our assumptions were that there were concerns around establishing relationships with the area office. And you heard from Lainey and a few other people that there are fears around the area office imposing supports on family members or the individuals that are in our care. And if you could pass over to the next slide, please, and then we'll just sit on that one. Our goal is to build relationships, and in order to build a relationship, it's important that families let us in and little by little establish trust. The common themes that I've heard today are around partnering and collaboration and strengthening and building supports and community connections. What we do not want is for families to feel that we're going to say hello, establish a contact, and then start imposing our expectations on what needs to be put in place to support your sons and daughters. It truly is a collaboration, and what we need to do is work together with whatever available resources we have at the time and come together to plan a way of us supporting you, support your children at home. We have also a respite in our area that was recently developed for planned respite in the Lexington area, and it was developed a year ago, but it took off in around July or August of last year, and we are now at a place where people are setting up long, stays for a weekend, for a week, for 2 weeks, for the very reason that Colleen kind of talked about, which is just to get a break. It could be a break from each other. It could be because family needs to go away for business or to a wedding, or that someone is having surgery. And the individuals have reported very positive feedback and engaged in their community in that particular respite location. We also have a family support center, which is the Riverside Community Care Center that you see before you. And it does all of the same things that you've heard earlier today. So we have about 350 individuals and their families supported, and we have 15 towns and communities in the Central Middlesex area office. They are available Monday through Friday. They're running weekend groups. They have events regularly. We have open houses and family dances and socials, and we're actually hosting an event at the end of this month. We're going to be doing kind of opening day, and we have invited people who are attached to the Family Support Center and people who are attached to our center to RSVP and come by and just check in and say hello, even if it's come in for 10 minutes or stay for the 4 hours. We feel like the goal for us, especially in this particular category of elder caregivers who are so reluctant to come to the table, is about establishing trust, about you letting us in to be a part of your family. And we too, like Colleen, have people that come and say hello, and they want to see what's available, and then they pull back and they stay away for a while, and then they come back to the door and they talk about options, and we talk about a whole number of different great opportunities, and then they pull back. And it is about not allowing us to be in regularly. It's about listening and pulling back and being fearful and wanting to keep their family network supported by only their family and not by what could be potentially a scary system with people who they don't know. I think for us, the connection, the conversation, future planning is paramount. I have a peer whose sister is in the system, whose mother has always taken care of her. So prior to actually, and I say system, I don't mean that in a cold way, but she's supported by the Department of Developmental Services. And prior to this, her being supported by the Department of DDS, she was being supported by her mother. And her mother was extremely reluctant to open the door and see what was available for her daughter. Unfortunately, mom got really sick and unexpectedly passed away. And what this did for the family, for the siblings who weren't expecting to have to support their sister in this case, it created a lot of confusion and concern. And my colleague talked about, some resentment in terms of not really having planned for the future. And I think, if anything, we ask that you let us in and let us be a part of your family and see what we can do to establish trust, to make you feel comfortable with us, and to not feel like we're not there to really be available to you, even when you're not in crisis. Because when we're dealing with a crisis situation, which is what we want to avoid, the decisions then are much harder and much more uncomfortable, because we're looking at an emerging need and a crisis that we have to address. So if anything, I ask that you let us into your family, that we respect the process, we understand the concerns, and we want to be a part of your inner network to be able to support you. I want to pass it off to Ellen at this point.
Okay, so I'm just going to talk about our next steps, which you heard a little bit from Lainey, but we're want to identify best practices in engaging and guiding older caregivers in planning for the future. In order to do this, we need to provide training for our family support navigators and our service coordinators, because you can see the engagement is really more finessed and intentional, and we just need to start wherever that family is. And then we need to strengthen the interagency relationships and partnerships with our sister agencies that will help us better support caregivers. It also should be able to help us improve our efforts to identify older caregivers, because they may be associated with our other sister agencies. And we need to find ways to support them through the local partnerships. And then you heard some snippets of what we're already doing. So we need to examine what we are currently doing and the supports that exist to engage and support our older caregivers. And we have to figure out how to replicate and sustain all of that stuff throughout the state. So those are our next steps. How we're going to do this is we are going to create regional work teams. We also want to engage stakeholders to be part of that. We're going to this will be done with the family support, the regional family support directors and myself, but we're going to, create more work teams and work on these next steps in, again, being better supporting our aging caregivers or older caregivers, so that we want to really avoid those crises. And we also want people to feel good about planning for the future and what's going to happen in their futures. So that is the end of our presentation. So I have no idea what time it is, and if there's time for questions.
Yeah, oh, thank you, everybody. I really appreciate that presentation. We do have several questions in the chat, which I can help moderate. We're nearing 12 o'clock, but if everybody can kind of hang on there for a little bit, we'll get through these. So one of the first questions was, if you're in AFC or adult family care or foster care, can you get family support?
Yes, you can. So Liz, do you want to?
Yeah, no, I just want to clarify the question. Did it say family support?
It said, okay,
Flexible,
is flexible funding available?
Yes, we have flexible funding available for people in AFC as long as it's very much associated with the person serves needs. And AFC families also can take advantage of things that are happening at the centers. We don't do the respite as part of that program, so we're not providing that. So it's again, very individualized. So if you have AFC, I would approach your service coordinator to see what is available through Family Support Services.
Okay, thanks, Ellen. And what about helping people navigate healthcare beyond the insurance?
In the family support, I guess more clarification around that.
Sarah, I don't know if you want to unmute and just clarify a little bit.
Thank you. The full disclosure is that I'm working with Harvard Medical School to try and help develop resources that allow people with disabilities to get better adult health care when they transition out of the pediatric world. And I'm trying to get a handle on what is already out there, because we're finding that especially people on the autism spectrum have a very difficult time finding adult providers after they leave pediatric care. And I don't know, and it's especially hard for the older caregivers who need to navigate their own healthcare needs, as well as the healthcare needs of their adults with disabilities. And I haven't found a lot on the sites, on the social service sites, that help people interact with the medical system. Sorry, that was long.
Well, actually, the ARC is has Operation House Call, which is, and again, that's for new physicians, but they do some work around educating new physicians on developmental disabilities and intellectual disabilities. I think if a family goes to the navigate, I mean, I think we could do this individually. We don't have any broad-based efforts in that area, except for the ARC, who's doing that work. So,
I think oh, sorry, go ahead.
This is Lainey. One thing that my office, the Office of Quality Management, has been working on related to healthcare is around preventative healthcare screenings and how to make sure that individuals that we support are getting the screenings that they need. And so we are updating some materials related to that, creating gender and age specific checklists, as well as doing some trainings, recorded trainings. And we can certainly make sure when those are published that we get those out to everyone on this group through Carrie.
So, and also, just I know the Department of Public Health is working on this very issue, as well as I think some of the more intensive family support programs that support medically complex kids. That's certainly something that, you know, comes up quite a bit. So, okay, so next question. Family support says available to DDS eligible families. Does that mean all DDS eligible or just eligible for family support? So I'm assuming that if a person gets, you know, like res or something, can they get family support or no?
Family support's available to families who have their family members living at home with them.
Okay. And then I've been led to believe that DDS respite programs are not open to AFC members. Is this accurate?
That is accurate. Yeah.
This is accurate, and we've received a lot of questions around that, especially for our 2 centers that I discussed. The primary reason for that is that AFC itself is a residential service that Mass Health funds, and it does a lot for 2 weeks of respite. I don't know what that respite looks like, and I think that differentiates between agencies. It is a waiver service. Our respite programs are a waiver service, so it's double billing is what it is. Unfortunately, I know that it's a need for families, whether they get some AFC funding into their home or not.
Thank you, Colleen. And it seems so much harder to find respite and supports for families with medically complex adult children who need nursing support. I hope to see more done for this population. So many parents are providing nursing and clinical support in the home due to the nursing shortage, and is unsustainable for all involved, yet there seems to be few options. And I think you mentioned that in your presentation, but I don't know if anybody wants to elaborate a little bit.
Southeast, prior to COVID, did have a respite for medically complex adults. It was only 3 persons. It was staffed totally with LPNs. It was really an awesome program. We were forced to close it because of the lack of nursing staffing, the same problems that the community case management folks are having also in helping all of you find nursing that you need. So it is something that we are committed to reopening again at some point, but I would say probably statewide that is certainly acknowledged. We just haven't been able to operationalize it yet.
Okay, thank you, Colleen. And you know, just families talking about being terrified when their medically complex kids are sick, and who's going to care for them. Okay, and they're also a group that may not have that family who can step in because their needs are so specific. Okay, so we have run into individuals that have a diagnosis of IDD, DD, autism, etc., but they don't meet eligibility standards for DDS, typically due to IQ, and unfortunately falling through the cracks and missing out on some supports and services.
I can just talk briefly. We have an intake and eligibility team in every region that reviews very carefully all of the documents and information that's provided. There's also a process for appealing the decisions through the intake and eligibility team. And so I think, without seeing a lot of clear information about what's being referred to. Certainly with the ASD only population, it is not based solely on IQ. It can't be. There needs to be a professional that has experience in working with autism, and there needs to be certain, I hate to use this word, but certain skill deficits that are in certain areas that are well documented. So we certainly could reach out for any individual circumstance that somebody wants to ask me about, and I can connect it to the right I&E team.
Thanks, Liz. And there was a comment to that one of the members said that they didn't know that the family support centers can actually help with future planning. So I believe that's more to come, and that's in your strategic plan. Another comment is, I believe areas would benefit from hosting a stakeholder meetings to form a coalition to support families with a range of integrated services focused on later transitional supports. And let's see here. I don't want to, okay. Okay, I see some issues in the South Central. They need some support, not a caregiver, but cannot afford housing, but don't qualify. So maybe talking about that autism population that's not ID, that doesn't qualify for residential services. So that just that the statement of need. And so Lee was wondering about the locations of support centers in Western Mass. I know, Ingrid, if they email you, you have a whole calendar out there on your email. So maybe you could put that in the chat.
Yeah, or we can, let me put a link to our statewide family support directory so that everybody can benefit from that. I'll put a link in the chat.
Okay, great. And we need a staffing campaign and should have a formal partnership with AA&E and tap into baby boomer groups, which is the largest population, can go at a slower pace, which we need our clients. I presented this at an appointed member of the Governor's Commission. So I do want to encourage all of you. The ARC, we work diligently on this staffing issue, legislative advocacy, disability policy, and I encourage all of you to get on our website and join our efforts, because it's going to take all of us to solve this problem. It's not an easy one.
And I just want to say that, you know, DDS has different work groups to address, or to attack, I guess, the workforce issues. It is definitely a challenge. But for families, we do have a couple of resources. One in particular is called Rewarding Work. And we can also send a link to that. It's a free service for DDS people and individuals and family members looking for particular supports. Can utilize that tool, and also people who have availability and are interested in picking up some extra hours and supporting individuals with disabilities can go in there and do a profile about their skills as well. So Ellen, do you want to try to pop that in the chat?
Okay, and then just to get through some of these questions, an idea about perhaps identifying older caregivers by offering sessions at local senior centers, and then also, you know, linking more possibly with elder services to be able to identify these folks. Let's see, does the program, the individuals is an impact which supports communication they receive from family resource centers? For example, if DDS eligible person is doing self-directed supports, are they considered their family support center, or should there be access and communication with the family support centers?
If the family members at home with them and they're self-directing, they can access the support center.
In addition to the other services that they
yes,
get.
yeah.
So I suggest the age of the individual in one part of identifying the aging caregiver, but the question to the caregiver should be asked, how old are you? It's critical that these dates be captured. Okay, let's see here, a few more. When is it likely that there'll be more respite with nursing support again? And are there plans for these to be an increase in service? If there's only one available in the area before it's closed, that sounds like an access with it would have been limited, and the number of people who need it are growing.
We have a program that's being, Lindley, I don't know if you wanted to talk about, they're developing
Mhm.
a program in somewhere in the Northeast for
That's right.
folks. Yeah.
Yeah, I tried to jump in when it came up, but I don't want to delay the process. But we are opening a medically a respite for medically complex individuals living at home, and are looking actually for it to be a valuable resource for some of our families who do not have alternatives to supporting their sons and daughters. We're going to visit it very soon, and we are hoping it to be open within the next month or two. The expectation is that people will be able to go in, and on intake, there'll be a plan for discharge and return back home. But it's not like it has to be only a day or two or three. It is definitely one that is very much like what Colleen described, fully supported by nursing staff and to address people with medically complex needs. We're excited.
Okay. All right. So I just looked at the time. I don't want to get, delay this anymore. I think we pretty much got through the questions, and thanks Ellen and others for putting in the chat. I want to thank all of you for coming today. And I also want to let you know that through the Dana Home Foundation in Lexington, the ARC of Massachusetts, we are offering a 3-session live training. It needs to be in person in Lexington on future planning and doing the letter of intent. So if any of you are interested, we're almost full, but we're going to develop a waiting list, and we're hoping that this is one of the best practices that you guys talked about, because having these conversations are essential. But I want to thank Liz and Eileen and Ingrid, Lainey, Lindley, and Colleen for a great presentation. And again, thank you all for coming. And this won't be the end of the conversation. We got to keep talking. Yep. And hope to have you guys back in about maybe a few months and see how things are moving. So thanks again.
Thank you.
Thank you.
Bye.
Bye.